So social prescribing is exactly what it says on the tin. It's a social prescription. It's a non-medical prescription. It's about engaging with that person and signposting, connecting them, engaging them with what is available in the community. There's multiple things that is available and are available for people, and we point them in the right direction. And ultimately that is the social prescription. It's about getting them to the right place at the right time to support their needs. So social prescribing in East Riding is a really exciting model. It's an opportunity for multi-agencies to come together, and we're doing a great job in connecting and working with each other to get the right support available for the patients that we support on the ground. It works by referrals coming directly in from general practice, primary care, hospital discharge teams, social care. Referrals come in. We've had over 2,500 since we started in May 2018. And that's exceeded the target that we expected, which shows the success of the project. We're in every GP practice across East Riding, which is very exciting. And I have a team of link workers who are dedicated to each practice in East Riding.
So as a community link worker based in general practice, I take referrals from GPs, nurses, receptionists, all sorts of other external authorities for patients who they believe need a little bit of support in a more social way, not so clinical, more holistic approach. I have a little bit more time to spend with people. We will come up with a plan, a personal plan for each client and try and get them to where they need to be, really.
And I think the benefit of social prescribing as a service is the ability that we have to delve that little bit deeper, to spend time with the patients, getting to know them really, so that they don't keep coming through the revolving door of constantly coming back in and using up GP time for appointments that aren't really a GP's role.
Then we have our community connector colleagues, and their role is to take over from the link workers. So once an assessment's been done with a person, a patient, and we've put some immediate signposting and support mechanisms in place, we hand over to the community connectors, which is supported by Hull and East Yorkshire Mind. And the connectors are out again working in the 6 locality areas of East Riding, and they do the hand holding, they do the face-to-face, the real nitty-gritty, ensuring patients get from A to B, making sure that they turn up for appointments that we've created for them, making sure that they have the support if they need help with paperwork completing, if they need someone to just be there to handhold them as they enter into a new group or community setting. So that's really exciting, that's been really successful.
So our referrals come through from the community link workers, and then I would meet with that, contact that client and meet with them to assess their needs and identify which resources they needed to be signposted or referred to, or if they needed some support in accessing services, then I would support them with that.
Then we have our community build colleagues, and they are made up of sports playing arts at East Riding Yorkshire Council, and they're really out there finding out what really does exist in these locality areas, and that's how we know there's vast multiple opportunities, community groups, organisations we can signpost people into, and they're building a directory service, but they also identify gaps. And what gaps we are presenting and finding at our first initial assessment phase as a link worker, we are sharing with them, and they're going out and helping to create opportunities. So whether it's men in sheds in an area, because we've identified that we've got 20 men who actually want to come together, have like-minded activities, interests, they will help us create that.
So normally when we go into areas, we do community consultations and have community health action groups. This looks at what's going on in the community, and if we find that there's a need for something, so for instance like the session that's running this morning, the disability adult session, if we found that in Bridlington there was nothing really for adults with disabilities, so this is something that come about, so it was my job then to promote and run this activity that's here this morning.
And the exciting element to the whole model is the fact that we've got the support of the voluntary community sector, and Smile Foundation act as the overarching umbrella support mechanism to act as a voice for that sector across East Riding, which is really one of the unique selling points, I think, of our model across East Riding. I'm really excited about what's happened in the last year in social prescribing across East Riding. I think we've been really pivotal in integrating and embedding what social prescribing is. I cannot thank the team enough for their amazing work that they do every day with the patients that they see and their experiences and what their outputs are. And I think that's second to none, and actually that in itself for me is something which is pivotal to the success of the service. My real key achievement is getting a social prescriber, a community link worker in every GP practice in East Riding. That is above and beyond that is exciting, and we've now got somebody dedicated across every GP practice in the area, which means that any opportunity to take someone out of the medical model and put them into the social, the non-medical model, we can do, and there's no excuse not to do that because there is a social prescriber attached to that practice.
At first, when I first heard of social prescribing, so I've done this job for sort of 25, 30 years, I was thinking, oh, how will this sit in? But so quickly, I realised what an absolutely excellent service it is. I think it's not just social isolation, there's lots of other things that sort of just go under the radar, that they just need a bit of encouragement and a bit of a help, and the signposting to the other organisations, and it's just finding that pathway for patients to be able to give them the help. So I found it absolutely brilliant.
Working with the surgeries in East Riding has been absolutely fantastic, and they've welcomed us with open arms. I think the key thing for me to identify is that they have 100% supported social prescribing. Social prescribing, I hope they see now as part of business as usual. And I think the majority, if we were to ask them right here, right now, would agree and say it is business as usual. Having that social prescriber, the community link workers embedded as part of that project practice team is been crucial, I think, to their opportunity to have somebody who can take pressure out of the medical system and put it into that non-medical. And one of the statistics is 80% of people that present at general practice around non-medical. And actually, how were we tackling that before? Well, actually having a link worker on board in the practice helps take some of that 80% or not, 50%, it's taking some pressure out of the system and putting it down another avenue. And they would categorically can state, all agree that it's been a real fundamental part of their growth as well over the last 12 months.
So I'm very aware, I suppose, that in 2019 that 10-minute box of the GP consultation is quite well bookended. And actually problems don't just fit into that neat 10-minute slot in the doctor's surgery. And I think as sort of holistic practitioners always trying to look for the global picture, I think social prescribing as an adjunct to our care, where we can really start to tap into our communities. I'm amazed at the breadth of knowledge that our social prescriber has about what goes on in the local town, despite me working here every day. And actually the ability of the social prescriber to hook into all of those different networks, it certainly goes beyond what I can sometimes offer in my room.
So social prescribing 12 months ago was something we were having to explain, undertake conversation about what it looked like, what it meant for somebody, and what really was social prescribing. 12 months on, people get it, they understand it, and they're taking advantage of the services, they're accessing the services, they're liking what they're experiencing, and they are using it. I think what I'd like to get to the point in 12 months is where it becomes part of business as usual. People know what it is, and they can't imagine a world without social prescribing in their everyday work. Social prescribing for me is something that isn't going to go away, and actually it needs to become part of the bricks and mortar of a true health and social care model, and I think that's where we will get to in 12 months' time.